Hi, and welcome to Kidney Plugged In. On this episode, we're pleased to bring you highlights from the Kidney Foundation webinar on how wellness and lifestyle impacts your kidney health. And joining us today are the two hosts of the webinar, nephrologist Dr. Mike Bevilacqua and Dr. Megan Borkum. And you'll meet them both next, right here on Kidney Plugged In.
Now, Dr. Bevilacqua joins us with a presentation on how wellness and lifestyle choices can impact your kidney health.
Really, one of the take-home messages I want to give people is that when we're talking about the concept of wellness, it really is a holistic approach to how somebody is doing. What it specifically is not, it's not binary, meaning it doesn't just mean one thing and you're either sick or well. It's not like a light switch on or off. And it's not just the absence of a bad illness or the absence of suffering. It's really assessing how someone is doing in all of these very important domains of their life. And I really like this approach that has taken, it has become much more common over the last few years, where we do look at all these various different domains. So yes, we have physical health as being one main component of wellness and the one that a lot of us might immediately think of. But you can see there are all of these other areas that are just as important, because a disruption in any one of them will lead, of course, to unwellness in that area, but then can have a domino or a knock-on effect to all the others. For example, if your physical health is doing well, but your emotional isn't, or you're having trouble in your occupational or work life, you can see how these all feed off of each other. So when you're assessing wellness, we're really looking at this whole spectrum, every component of the individual. And when we're thinking about something like a chronic illness, like kidney issues, or really any chronic problem, again, even though a lot of people might think of that as being a physical thing, it really can impact any of these domains. And the impacts can change as time goes on. When you're really doing an inventory and thinking about what your wellness might be in any one of these domains, I really think that it's important to take stock of two things. And this is what I try to do with some of my patients as well when we're going through this. You take stock of what symptoms are coming up, but also what impact that's having on people. And that will then lead into what we do with it. But I like that it breaks it down into assessing both of these parts, right? So for example, you can say, okay, if somebody's having a lot of issues with fatigue or tiredness, well, that's one thing to say that, I feel fatigued. But then when you start unraveling, how is that impacting you? Has it made it so you can't go to work? You can't do the activities you like to do. You don't have the energy to even get up and socialize with your friends and loved ones. Now you can see that really starts to paint a picture of how that's impacting the person. And we can do the same thing with physical symptoms, right? A common one being something like if someone's having chronic pain, okay, well, how is that limiting you? Is it limiting your ability to get around? Is it limiting your mobility? And you can see that although we might have the same symptom, we can have various different levels of impact. And as we assess that, we sometimes do this as physicians, but this is something that you can take stock of yourself as well. Then it really starts to lead into how you might start to approach it. And we're going to come back to approaching this and strategies to manage impacts on wellness a bit later on. So wellness, to summarize, is not just one item. It covers all of these domains of your well-being. And if you're thinking about this, think about both what's happening and how is it impacting you. I've used an example here of something from polycystic kidney disease. That's why it says this at the beginning. It's one of the things that I do a fair amount of. But this applies to anything. I just like the visual here, so don't worry too much about the specifics. But what I like is that it shows that through the course of somebody's life or through the course of somebody's experience with a chronic condition, we go through a lot of different phases. We often think of it, and sometimes it can be easy to just label it as, oh, this is kidney disease, and it's one item that's kind of there. But there's a whole lot of trajectories we go through. First, people just learn about the diagnosis for the first time, right? So you're newly diagnosed. You get into some basic initial management part. So maybe the medications and treatments aren't as intense in the early days, and you're focusing on some of these aspects of wellness and your self-management. Through the course, you might go through various treatments. Now, all of a sudden, you're starting a treatment or stopping a treatment or something new or a different procedure, up and down and up and down. And again, those are going to cycle. And then with some of our kidney diseases, some people do go on to then need even more intensive treatments. treatments. People might need transplants or dialysis treatments, and then they might go back and forth between some of those. So this is all to say that this isn't a straight line, or this isn't a one-time item when we're talking about a chronic condition. And through these different phases, there's going to be different components of your wellness that might be impacted. In the early days, you might be more of the emotional side of learning about this new diagnosis. And then you go on to a different treatment, for example, and now the physical part of it comes to the forefront. So as you shift through, these items might change. Again, another reason I really believe in that, if this is something that you're tracking, I believe in the concept of things like journaling, where you actually see, okay, how is this changing over time and what's my focal point here and now? One of the things that makes some of these very challenging to manage impacts to wellness is they become, as we call kind of, our technical term is a positive feedback loop, or the term that we use for that is a self-fueling fire. Meaning, if we're talking about something like chronic fatigue or chronic pain, these are very classic examples of this. That if someone's having a lot of issues with tiredness, it's going to be very hard for them to be physically active. And then if they're less physically active, they'll go through a process of what we call deconditioning, meaning if you're less physically active, you lose some strength and some aerobic capacity, which will make it even more hard for you to be active. It will actually feed into make some of the symptoms related to your disease worse. And then that cycle just repeats. It kind of gets harder and harder and harder to break that and get out of it. And the same thing can happen with all various disruptions to wellness, that if we leave them unchecked, they can actually start to feed into that component and other components of wellness, and you kind of just get into this worsening spiral. And that's always the worry. But I want to be here saying that, we can break these cycles. And this is obviously, we're here to talk about strategies. And for each of these, we do have different ways, depending on where we're at, different strategies. And we'll come to this and see a lot, some advertisement for the Wellness Hub, where there's actually some great resources for exactly this type of thing, that depending on which component we're talking about, you're going to want to target it with various different strategies. Again, I've used this for chronic fatigue because there's a lot of good research in this area that shows just how effective implementing some of these strategies can be, where although the process itself, if you kind of let the beast of the process take over and you get into that self-fueling fire, might say, you know what, I'm having tiredness, I don't want to be active, and it gets harder and harder. We say, okay, where can we actually implement some strategies to maybe bring in appropriate small amounts of activity to at least break the cycle, at least disrupt that and not let it take over and get into that positive feedback or that self-feeding fire. So to get at a few strategies for this, I think that really, if we're going to be mindful about specifically enabling wellness and specifically targeting a domain, we really need to come up with a dedicated plan for this. Just like we might come up with a treatment plan for parts of our kidney condition or other illnesses, we're going to want a specific plan to intervene on one of these. I also want to put out here that as you're doing this, do seek resources for this. You're not alone, right? Sometimes a lot of these symptoms, and especially as you kind of go down into that worsening spiral of some of them, it can seem quite isolating. It can seem like you're alone, or it can seem like you're the only one dealing with these. But this is not the case. Having that support of people around you helps to implement these plans. It also helps as you're going through a plan to have other people around you to both help and kind of coach you through this. I love this term of what we call an accountability partner, as you're going through plans. For example, even myself, for my physical activity, my wife and I, we do our exercise together. And, depending on any given day, one or the other of us won't want to wake up when that alarm goes off. Sometimes it's me, sometimes it's her, but having both of us together to kind of, motivate each other and help keep each other to our plan, that really goes a long way. And so, having someone you have that relationship with can really help with this as well. And you're going to hear a little bit more about these resources. But when it comes time to develop a plan, what exactly is it that we're talking about? And again, I keep coming back to this concept of journaling, which I'm so fond of. And the same would be true of developing a goal. And I'd say if you have something that you want to impact, actually physically writing this out sometimes goes a long way. Writing out, what is my goal? So if, for example, I keep coming to that point of activity because it does help with so many different domains of wellness. If you're saying that, I want to become more active, actually putting this to paper and writing this down in your journal helps both for you to visualize and really commit to what that is. And then you can see how that has impacted the various symptoms that you might be journaling. When we're developing a goal, some of you may have seen this before, this concept of what we call a SMART goal, and that being an abbreviation that stands for these items. So you want your goal to be specific, meaning not just, I want to, in general, I want to be more active, but very specifically, what is it that you want to be able to do? I give an example here, but I want to be able to go for a 2-kilometer walk without having to stop, or without, being able to do that completely and get to from my house to this destination, right? So very specific about what we're aiming for. Part of that is it's measurable. I said something like 2 kilometers. You actually have a number, not just this nebulous concept of I want to do more, but specifically what are we doing? The A, I think, is one of the most important parts, especially when you're already starting in a place where one of your components of wellness has been impacted, is that it does need to be an achievable and realistic goal. Meaning, if we set the bar too high or to something that's maybe a little bit too far into the future or is too far kind of beyond our current capacity, you don't want to set yourself up for something that you can't attain. You're better off setting multiple small and achievable goals and seeing that progress along the way, because then you get that motivation. You can tick those boxes of, yes, I've done that, rather than setting some very, very, pie in the sky thing that might take years, if ever, to achieve. So that's another strategy that I had a lot of patients have success with. Small, multiple goals that ultimately will lead you to exactly where you want to go. And then timely, that last part, I think, again, quite important, is that having, just like I do for when I have, for example, to give a talk like this, having a deadline, having a time set in mind you want to do this by is a very motivating thing. I'm very glad that we're talking about this now, because in addition to this always being important, I think it is worth mentioning that a lot of us have had various aspects of our wellness challenged in completely new ways and completely, dramatic ways that we haven't seen before. People always talked about, and it's kind of settled down talking about these waves because we're kind of just in a constant sea of infections going out there. But, people talk about the waves of infections, but didn't think about the impacts that had in terms of wellness. And I think they were different ones, right? Initially, as people kind of got into this, environment post-COVID, it was all about the physical, right? The actual illness itself and the impact and the danger of impact, especially if you're on certain treatments and things like that. But then we got into these other waves that have, I think, if anything, have had even more of an impact on wellness. It's been harder to access all kinds of things, not just medical care, but it's been harder to, for example, if you were in previously a gym or a club that did various activities, some of those went away and that wasn't there. That impacted people's social connections with one another. And then you can see as it's come up, and I like that people were thinking about this goes back even a year or so ago, that this is where we start to see all these other components of wellness now that might even predominate compared to the physical side. So again, I just want to mention this to say you're not alone if you're feeling like this, and it's an important thing to take stock of and be on top of.
And now, Dr. Megan Borkum joins us to discuss how wellness and lifestyle choices can impact your kidney health.
I'm going to be talking about a passion of mine, which is exercise in the context of kidney disease. I'm going to use the term physical activity and exercise interchangeably, but exercise is just planned physical activity. And I think we need to remember that exercise is applicable at any stage of your kidney journey, all the way from pre-dialysis to whatever modality of dialysis you choose, and to transplant. There are benefits all across the way. So you get a cycle, you get a spiral, but we know that unfortunately we see often our patients have a cycle of inactivity, and that progresses to a downward spiral. So as the kidney disease progresses, due to multiple factors, including the symptoms associated with kidney disease, like low energy, pain, restless legs, a lot of mood symptoms as well, and people do feel quite isolated, especially when they're not part of a community. And associated with that, physical changes like losing muscle mass and losing function, becoming more frail and frequent falls, people become more and more debilitated once quality of life goes down and there are more hospital admissions, and that's never a good thing. So this is what we really hope to target, and exercise can address many of these domains. So I like the saying, if exercise were a pill, it would be one of the most prescribed treatments. And exercise is so good because it helps many different components of the disease. So firstly, muscle. So we know that with kidney disease, through not using the muscles and through the disease process itself, one's muscle bulk goes down over time. So exercise keeps the muscle active and keeps the muscle strong. We know then there's good science for this, that exercise improves a lot of kidney symptoms. We know that it improves restless legs, it improves fatigue, and it also helps with depressive symptoms associated with chronic disease and dialysis. We know for sure that exercise improves physical function, so how well people can move around in their day-to-day life and do activities of daily living. And we know that exercise improves quality of life. And there's more and more evidence. This is a big area of research across the world about the heart healthy benefits, specifically for kidney patients. Again, both chronic kidney disease patients and patients on dialysis and transplant patients, how it improves heart health overall, both directly and through weight management, as well as helping control blood pressure. So definitely there's a lot of bang for your bucks there. So in terms of the prescription, it's a pretty generic prescription, but it's a good thing to work towards. Obviously, if you're just starting an exercise program, you want to set your SMART goals, as Mike discussed. So you don't want to start by running a marathon if you haven't been exercising for a while. It's recommended to do 150 minutes a week at least of moderate intensity activity. So that's, for example, cycling or jogging or fast walking, or at least 75 minutes a week of more high intensity exercise. So that's things like running or rowing a boat. And then in terms of resistance exercises, that's recommended to happen at least twice a week. So things like this would be lifting light weights or doing specific resistance band exercises, or things like yoga or Pilates. And I like the sing talk test. So when you're wondering about the intensity, you should be exercising at the intensity where you can talk, but that you can't sing a song. And if one works towards slowly building up over time, one can certainly reach this. If you think about 150 minutes spread over the week, it seems like a lot when you look at the number, but if you divide it by 7, it does become more realistic and achievable. So we know that there are multiple barriers, unfortunately, to exercises. And again, this is things that have come from scientific papers, surveys of patients. We know that patients are scared because they don't want to injure themselves. They often don't have support to encourage them and to facilitate exercise. People think that exercise is expensive, so you have to belong to a fancy gym. And often the symptoms are the greatest barrier. So things like fatigue, weakness, and shortness of breath. And people just don't know where to start. From a health professional perspective, bearing in mind that we often don't have access to rehabilitation or exercise professionals, there's often other care priorities. So they're more worried about, us as health professionals, we're more worried about the lab parameters and the blood pressure, and maybe less worried about talking about exercise with our patients. And often people don't maybe have the expertise to discuss exercise specific to dialysis patients or kidney patients. But as I'll mention later, there's a growing body of evidence and guidelines that are well available. And I think it's our responsibility to become familiar with these guidelines so we can discuss exercise sensibly and scientifically with our patients. And I think it is something, bearing in mind all the benefits that are possible, that we should start to prioritize in our care plan. So the first step, discussing it, opening the discussion with your health professionals, that's the first step to get going and to overcoming these barriers. So there's always a question. So once you've had the discussion with your kidney care provider, where does one start? So of course, different people will have different starting points. So an older 70-year-old patient with chronic kidney disease, fast walking 3 times a week might be a good amount of cardiovascular exercise for them. But a 25-year-old who's just been diagnosed with chronic kidney disease, who's quite healthy, he might need to run 3 times a week. So people have different expectations or different limitations, and that will determine where they start from. So in terms of planning exercise and goal setting, we've discussed the SMART goals. In terms of how to build it up, so it's important to plan the frequency, so how often you want to do the exercise, bearing in mind we all have different schedules, so how exercise will fit into your daily schedule, the intensity, and how much time you want to spend exercising. And again, I can't emphasize enough, start slowly, because often people are very enthusiastic and they start and then they may get an injury, injure their knee, hurt their ankle, and then they'll be put off exercising. So it's important, especially if you haven't been active for a long time, to start slowly and build it up. And goals should certainly be easy and achievable. They should be obvious. So if exercise is part of your routine, you're less likely to not do it. So if you say, okay, I'm going to exercise every Monday, Wednesday, and Saturday morning, first thing in the morning, wake up early and exercise, you're more likely to stick to your routine. Whereas if you just do it sporadically, one always makes human nature to make excuses not to exercise. So if it's part of your routine, a lot easier to stick to. Exercise needs to be attractive. So I know myself, when it's raining outside and I want to go for a run in the morning, I'll run in front of the TV. You can use your elliptical pedaler while watching TV. Then, time passes by quick and people can be amazed what you can achieve. And exercise is satisfying if you have goals and you can track your progress towards your goals. So for example, if you maybe want to lose a few kilos of weight, you can track your progress and say, okay, I want to exercise that I can lose 1 kilo every 3 weeks. And then one gets a feeling of a very rewarding feeling when you see that you're actually achieving that goal. But most importantly, exercise needs to be enjoyed. It needs to be enjoyed so that it can be done regularly. So you need to find what you enjoy doing and stick to that. In terms of what we can do as the kidney care team, so we definitely need to advocate for health professionals. So a lot of our teams have dietitians and social workers who are all very important in our team. But because exercise professionals traditionally aren't part of the kidney care team, they're not routinely available. Some units in other parts of Canada do have professionals like kinesiologists that play an active role, not just for exercise, but also in falls prevention clinics and in rehabilitation. So we've just advocated for a rehab assistant in one of our dialysis units who's helping patients on dialysis to exercise. And we can already see that more and more patients are engaging and joining the program and reaping the rewards. We need to ask our patients what they do, and we need to encourage and motivate the patients and enable them to find out what their concerns are and try and address those concerns as much as possible. And of course, building the awareness. So being aware of the guidelines that are out there, being aware of exercise recommendations, and sharing any community events. So if there's a big walk, letting our patients know about it, and sharing online resources, which I'll show you shortly. There's a large amount of online resources available, specifically tailored for kidney patients, but people aren't aware of those resources. So we can expose our patients to these resources and encourage them to use them. This is the photos we had a kinesiology student helping in our dialysis unit. You can see him doing some resistance exercises with one of the patients, and the other patient in the top photo cycling and doing light weights while on dialysis. And they very much enjoy it. There are yoga classes, live classes, interactive classes, and you can be connected to a community of like-minded patients. It's important to remember though, when you're starting an exercise program, it's important to address other aspects. So things like nutrition and mental well-being. So the nice thing about the Wellness Hub is it focuses on holistic wellness. So not just one component of wellness, but social connections, psychosocial support, as well as wellness coaching. And there's also discussion forums for patients to interact. And you can be even connected with a peer mentor who's also living with kidney disease. One can't make positive lifestyle changes if you don't also address other things, for example, things like weight and other vices that we all have as humans. So addressing all of these factors over time certainly builds towards overall wellness. And as I mentioned previously, exercise is best done when it's enjoyed and varied. So group participation and even gamification of exercise has been tried in some places. Exercise that is planned and done with a group is most enjoyed. So I know myself, sometimes when I go to some of the exercise classes I enjoyed, I don't feel like going, but my friends in the exercise class encourage me to go. And then I never regret going to an exercise class because it's also a good time to socialize. And it's quite nice, even in the kidney community, even the virtual kidney community, with the live classes, you can interact with other people who are experiencing a lot of similar problems. And like I said previously, again, monitoring progress is the most rewarding thing. So even if it's just something as simple as closing the rings on your Apple Watch, or tracking your weight, or rewarding yourself after you achieve a milestone, monitoring progress helps to keep oneself motivated and encouraged. So my take-home messages are simple: that physical activity is important. We know it can improve quality of life at any stage in your CKD journey, as well as many other factors of health and well-being. And any movement is better than none, because that downward spiral does happen. No matter what age you're at, no matter what your GFR is, if you don't use your muscles, if you're not active, if you're not exercising, the downward spiral and cycle of inactivity is unfortunately a reality. It's important to start slowly, do exercise you enjoy, and set goals for yourself and build it up over time. There's a wide variety of online resources available, and really enough resources to cater for any person with with physical impairments, with different levels of exercise literacy. So it's important to look, see, find, explore, find what you like, and stick to an exercise plan. And also just really discussing with your kidney care team and finding out what is recommended for your specific condition. It's the best place to start and is highly recommended. So thank you very much for everyone's attention.
Leave me a message and I'll get back to you.
I can't believe it's been almost 20 years since we met. My whole life has changed. Whenever I felt alone, you were there for me. I guess what I'm trying to say is, I couldn't have done it without the Kidney Foundation. And now, I need you more than ever.